Hi, What the Hell Tech listeners. I'm your host this week, Hayley Levene. This is the podcast where we tackle some of the trending topics, ideas and best practice in health and social care. This week, we're speaking to Craig Rainford. Craig recently joined Radar Healthcare as our new project manager, has worked for Four Seasons Healthcare for 20 years, was it?
Yeah.
A long time. Outside of work, Craig loves sport, and alongside his daily visit to the gym, even on a Sunday.
Yeah.
Okay, not Eli's in his intro. You can often be found at the Etihad Stadium supporting Manchester City. I mean, this intro is just not going down well. I'm already, I don't like City. So welcome to What the Hell Tech. How are you happy to be here?
Yeah, absolutely. Thank you for having me. A new experience for me, but definitely looking forward to it.
Yeah, no, it's good to have you here. So I just want to chat to you about making the move from Four Seasons to Radar Healthcare, why you decided to make the move after 20 years, and kind of the differences between working from a partner to a supplier. So let's get started. So the question on all of our lips, why? Why did you make the move after 20 years to Radar Healthcare?
Yeah, so I'd say this has got to be probably the most asked question that I've had in the last sort of like 6 or 7 weeks that I've been at Radar. I mean, rightly so. Yeah, having worked for a company for 20 years, it's always going to be the number one question. And I think for me, the reason for the move was because it was just kind of like the right time. I'd worked obviously for Four Seasons for 20 years, and working in the health and social care sector, I'd kind of become very passionate and proud to kind of like work in that sector because it's a rewarding sector. It's challenging, but it's ever so rewarding, especially when you can see the impact that it has on the people that are kind of like the end of that service that you're delivering. So yeah, it just kind of like felt like it was the right time. And it's one of those things that I kind of like look back at my time with Four Seasons and think it was kind of a privilege. Like getting into the industry, obviously my background kind of like being IT and all the time that I've sort of like spent sort of like progressing through various different roles. Yeah, I've learned like sort of like so much there, and you know, I'm very thankful to Four Seasons for, you know, the knowledge and the experience that I've gained through working with them in all of that time, because had I not have sort of like been there, I maybe would never have ended up at Radar after all. So again, maybe perhaps the reason that I'm here is because of that, given the fact that they're also a customer of Radar as well. So yeah, so in terms of the move, it was just kind of like the right time after having spent 20 years. It kind of felt like I needed a new challenge, something more to sink my teeth into. And I guess this has always been kind of like an area that I've been interested in a subtle sort of way.
Yeah, so like you say, Four Seasons are a partner of Radar, and I think you've worked with us for the past, is it 2 years?
That's right, yeah.
And you've been working with one of our project managers the most of the time, called Sarah. So obviously making the move here, how do you think you can help other organisations, obviously switching from partner to supplier? What's your experience and how can you help?
Yeah, so quite right. Obviously we've been when I was working for Four Seasons, we'd been a partner with Radar for 2 years. And I think, that can, hopefully it's going to benefit me, but hopefully it's going to benefit our customers. You know, I kind of have the knowledge and experience that I've gained there of essentially going on the same journey as what any customer that I'll be onboarding onto the product has gone through, albeit it's always going to be different. Obviously the beauty of Radar is that it's so customizable, so configurable. And I think that's really important, and it's one of the main reasons why Four Seasons bought it in the first place. So having been like the project lead on the customer side, I've gone through like, I've got first-hand experience of, what those challenges may be, especially working for an organisation that, Four Seasons is huge and still is huge. I think at the time it was, I'll probably get the numbers wrong here, but it was in excess of 150 services across England, Scotland, Northern Ireland, Jersey. And that comes with its challenges, lots of different regulators, whether it's CQC, whether it's Care Inspector. Jersey and Northern Ireland obviously have their own regulatory bodies as well. And at the time, Four Seasons were also going through a period of change, like structurally, in terms of the way the organisation was being ran. Our journey was quite complex. Not every journey will be as complex. There'll be some that are more complex than ours. I I think from my perspective, it's just having that appreciation, I think, of what the customer's going to go through. And hopefully I can bring something to the table when customers are going through that journey in terms of, number one, delivering a project, but also having appreciation of it's not always going to go according to plan on their side, and maybe being able to sort of like help with the experience and knowledge that I've sort of like gained over the way.
Yeah. How do you feel about that challenge moving from, because obviously you've seen one version of a project, albeit very complicated project, lots of different services. How do you feel about kind of taking new approaches and meeting different customers that want different things?
It's kind of the reason why I'm here, because that excites me. After being at a company for 20 years and obviously working in the way that I've been working for that time, albeit not doing the same role for the whole period of time, but you work with specific people, and there's processes that are kind of like embedded into organisations. So I suppose it will be a little bit difficult to me to sort of like break away out of that thinking in terms of I very much knew what Four Seasons wanted before they even asked, and how they wanted something to be delivered. But at the same time, you know, that won't be right for every single company. And even now, like 6 or 7 weeks in, you know, I've been shadowing like other project manager calls with other customers that are not necessarily care home businesses, but, you know, they might be dentistries, they might be ambulance services. And it's actually really interesting, and I'm enjoying it, just listening to sort of like what it is that they want to do with the product. And it's obviously encouraging the fact that the product is able to sort of like be customized to that level that they want. And, you know, I'm starting to feed into those conversations a little bit like, oh, well, have you thought about doing it this way? Or have you thought about doing it that way? And it becomes just kind of like a natural conversation and partnership working really to sort of like both meet, you know, what the customer wants and obviously radar, making sure that the customer maximizes the potential.
Yeah, partnership working is what we're all about, and having someone like you who can actually give advice from the experience of an actual organisation in social care is going to be really key for our customers. So quite excited to see what you do. No pressure, Craig.
I know. Maybe setting myself up here.
So how's it been first couple of months? How are you getting on with the team? How you don't have to lie if you're not liking it, you know. No one's listening really. How's it going?
No, really good. I have to say, you know, first day was nerve-wracking.
Yeah.
Not necessarily because, you know, working for Radar, more just those natural sort of like first day nerves that you're always going to get when you join a new company, or at least I suspect most people sort of like go through those feelings. And I think that was only sort of like amplified, I think, for me, because I basically worked for the same company for 20 years. So it's not an experience that I'm kind of like used to, being the new guy at a new company. So yeah, my first day was a good day, a really enjoyable day. I was meeting the new team at Leeds, in our Leeds office. So my first day actually started with a train commute. Now, I normally drive everywhere that I go because I just don't like relying on public transport whatsoever. Yeah. So I just like the fact that I can just get in my car whenever I want and just go wherever I need to go to. But that would involve a trip on the lovely M62, which I think most people have a hatred for that motorway, and me especially, and especially at rush hour as well. So yeah, the train just seemed the sensible approach. And I actually really like it. I probably do like a day, I do a day a week, sort of like in the Leeds office. And I actually really enjoy that commute because I can just get on the train. Thankfully, there hasn't actually been a single delay. It's always run like clockwork at the moment, going to and going from, which is always nice. But yeah, it's actually allowed me time to do something that I've always liked the idea of doing, but for whatever reason, I just never dedicate time to it because either there's something on TV or there's a football match that I can watch or whatever. There's always something where I can just think, yeah, I don't have to do that. And it's basically reading a book. So I've always liked the idea of doing it. And, you know, Christmas presents, birthday presents, I'll buy a series of books, and I'll read probably like 3 or 4 pages of them, and then I'll never look at them again. So yeah, Sophie, my partner's always forever saying, you know, what's the point in buying your books because you never ever read them. So yeah, I'm actually enjoying my hour sort of like on the train. I can just switch off and I can just read a good book. So yeah, at the moment I'm reading Shoe Dog by Phil Knight. So it's basically the story of Nike. So one of the biggest brands in the world. So yeah, it's actually really interesting sort of like where that was born from and how it came about to become one of the biggest brands in the world. So yeah, it's a good read. I recommend it.
Yeah, I might have to check that out. But on your next journey, you can listen to yourself on a podcast.
Well, but yeah, and then I suppose arriving at the Leeds office, it was quite nice because the whole team were in on that particular day because it coincided with a project team meeting. So it was actually, I was kind of nervous at the fact that joining a new company, what was that onboarding process going to look like? Obviously, there's a lot of remote working. I was going to be based from home, given the fact that I live in Greater Manchester. So how would that work? And it gives kind of, I suppose, a new angle and an added challenge to the fact of how do you build relationships with, you know, other members of the team if you're not sort of like sat in a room with them. So yeah, I was kind of semi-conscious of that, I suppose. So yeah, the first day was great because it just gave me the opportunity to meet the team sort of like face to face, and not even just the project team, but also the wider team. There was a few people from marketing, Hannah from HR was in, there was a few different people that were in. So yeah, it was really nice. And I suppose the good thing is that everybody was so welcoming, and that's been right the way through as I've sort of like met people sort of like along the way, and really, really supportive.
That's good. How has the onboarding process been for you?
Yeah, it's been good. As I said, I was nervous about it because or apprehensive, should I say, because how is that done when you're not together and you're not working with your team? But I like the fact that it's just been it's so varied. Yeah. So there's a good mix of like one-to-one and group training on a variety of different topics with different people. The group training has been interesting because there's kind of like a program that includes like other new starters, not necessarily from projects either. So there's been new starters from the development team, or there's new starters from customer success, or from the support team. And that's actually been really nice because everybody looks at Radar or works with Radar in a different way. So the way that we train and the way that we learn about it, we all touch it in different ways and means, and we'll all support customers in different ways. So it's actually been quite nice there's been questions that have been raised on there that I would never think about because I'd maybe never used the product in that way. Yeah. And it's a good way, obviously, to meet other people of the team. So I'm quite surprised, obviously. There's a couple of people that were on there, one of which lives like 10 minutes down the road from me.
Oh, really?
Which, yeah, small world and all that. So, yeah, so it's been really nice. So that's been nice, the fact that it's been so varied, and the fact that I've had an opportunity to sort of like sit down with my line manager and go through sort of like objectives for like the next 6 months, because I really like that, just because we can agree, you know, what am I aiming for? What are the goals here? And how am I going to be measured in terms of, you know, performance and success with the company? Yeah. So yeah, it's good to sort of like get that set out from the outset, really.
That's good. I'm sure Chloe would like to hear that. So obviously going back to your experience with Four Seasons, so what do you think that you can provide to other organisations, or what's like a piece of advice that you would give to them when they're thinking about a big implementation like this?
Yeah, so I have thought about this question quite a lot, I'll be honest. And it's quite varied, I think, maybe my answer. I suppose it all depends on the particular business. It depends on where they are. It depends on what their current processes are right now, whether have they got systems already? Are they just using paper or Excel, or how nurtured are they, I suppose, in the systems that they're using? And I think you've got to kind of maybe take a step back and not just look at a short-term problem that you might have at that time that you're trying to fix, but actually take a step back and look at like the overall picture and try and get a full understanding of what is it that you're actually trying to achieve, and what are the overall goals. So, you know, what is your digital strategy? What are you working towards? Not, I've got this problem and I need to fix it, so I'll buy this system to do that. So yeah, it's putting your head above water, really, and sort of like looking what's out there and just making sure that you're addressing that and you're forward thinking, I suppose. I think that's it. And as I said, there's no one size fits all to that question. It just depends on where you are at that time and what it is that you're looking to do, and making sure that, whatever system it is that you're looking at, is it going to be scalable to your requirements? Are the team behind it going to be able to support you? And does it fit in with that sort of like overall strategy, or is it just fixing a short-term problem? It's not an easy thing to sort of like do, but I think it's something that's vital to the whole process overall.
And are there any challenges that you faced in particular when you were working on that side that you think people should think about?
Yeah, I mean, I think the particular challenge that I had with Radar was the fact that it was 3 systems that we were kind of like nurturing into one.
Yeah.
So that was our particular challenge. We had systems that are kind of like already been, they were well mature, sort of like in the business, but they didn't do exactly what we wanted to do, hence the reason for the change. And yeah, I suppose we addressed that by, we knew from the outset what we wanted to do. We knew the direction of travel that we wanted. We knew that we didn't want an organisation that would just basically provide you with a piece of software and then anything that we try and do in the future we're going to be hit with charges for, or the speed in which they react to the things that we need to do wasn't going to be there. We kind of like wanted that partnership working to, I suppose, make sure that they're, to a certain degree, an extension of our business. So yeah, I think that was like the particular challenge that I've experienced. But yeah, no doubt there's sort of like several more out there for sure, but it purely depends on where that current company is and what the current state of play is, I suppose, that they're trying to fix.
So when you talk about like the partnership approach that you wanted, how did you find that with Radar Healthcare?
Yeah, really good from the very start. Everything that we were kind of like told through the sort of like demoing and tendering process came to fruition, really, which, you know, was really encouraging, up to the point where I obviously left the organisation. It was quite stressful, I suppose, the initial things that we had to do, because there was timescales to everything that we were doing. We had licenses for systems that were ending very, very quickly. There was big processes that we needed to get into Radar. And if anything, it kind of, the good thing about it was that it gave us sort of like a clear pathway in terms of what we had to do in the system and when. So there was a particular event that we needed to build sort of like very quickly. Turns out, I think to this day, it's still the biggest event that's ever been built in Radar. Don't know whether that's quite right, probably have to check it, but certainly at the time and certainly up to last year it was the biggest. I don't know whether it's been replaced since, but yeah, it was a very big event and very complex. But, you know, even just through that, as you say, Sarah was our project manager. The amount of times Sarah and I spoke over those sort of like 2 months in getting everything doing, we basically pretty much became best friends, I think, because we spoke like every day. And, you know, there was other members of the team, the project team, that I know kind of like worked on that particular part of the project as well. So straight away, I knew that the partnership working was there straight away. Everybody knew what we needed to do. They knew what we needed to deliver. And we did it. And again, it's sort of like going back to the last question, I think that's important as well, you know, to make sure that partnership working is successful. Both sides of that party, they need to know what the goals are, what the challenges are, and, you know, where we ultimately need to get to. So it's about being open and honest, I suppose. And yeah, right throughout, we've had that with Radar. Yeah,
really good that you say that. When I talk to customers for case study calls or in the podcast, actually, we had Milton Keynes on a podcast a few weeks ago, and Paul, you as the risk manager there, he said that because they had to change systems and move to the new LFPSE service all in one go. And he said, if I look back, I probably wouldn't have done it in one go. However, the partnership approach has helped us through this. And it's, I think it might have been you that said it when we were talking to you about your case study, and said that you've not seen this in a supplier before. So why do you think this is so rare? Obviously, you can, it's up to you what you say.
It's the $1 million question, isn't it? I honestly don't know. I think what Radar do really well is they focus on the customer. The customer is the most important thing. So, you know, the way that they've kind of like structured the business in the background, the fact that you're assigned a project manager at the start, the fact that you're assigned a customer success manager, there's obviously the customer support team that kind of like underpin all of that as well. So there's a number of different layers to the support that you've got. There's an escalation path that you can go through. And everybody's kind of like a part of that process from the very beginning. So it's not like you have somebody, which is what I've seen in the past, you have somebody that's kind of working with you, and then you get to a point where they've kind of like finished your bit of the work, and maybe you're now just an in-live customer, and you just need you your hand holding sort of like through the process, and you just need to be looked after, and you get passed on to somebody else, but maybe they don't know like the history of you as a customer and what you've gone through and the complex work that maybe you've gone through, particularly what we've done with Radar. So that's where things can kind of maybe be a little bit unraveled. So yeah, I think from what I've seen from Radar, and I have no idea why it's so unique. And maybe it's not unique. Maybe it's just, it is out there, but Radar just do it very well. It stood out for me. And yeah, I mean, we've had working groups sort of like through the process. It's not all been me. I had people within sort of like 4 Seasons that were supporting me as well. And everybody sort of like said the same thing. So this isn't me sort of like sat here saying this because I'm now working for Radar and I want to make them sound good. It was right throughout the business. And I suppose with that, the sense of achievement that you get from you deliver something to what we believe we want, and then that goes out into the business, and the sense of achievement that you get when you start hearing feedback from people that I'm really enjoying using the system. It's much better than the other system that we were using. That's obviously massively satisfying. And there are things that we didn't get right, because you will never get everything right in one go. But I also think that's like really important in a project as well, that you can have a bit of a you said we did type thing, because at the end of the day, the way we tried to push it in 4 Seasons was that this is their system. So it's not Radar system, it's their system, and they need to kind of like own it as a product. So if they want to do something, and this isn't necessarily the people that are just sat on the project team delivering it, it also goes down to the people that are, the operators, the people that are going to be using it, every day, because it's more important that they get a good user experience and that they enjoy using the system. If they don't enjoy using it, they're not going to use it. And obviously they have to use it because it's part of their system, but they'll probably put in the very least to do what they need to do their job. So if you can give them a good user experience, then I suppose a byproduct of that is that you get good data that kind of comes out of there, and you get good insights, and you get better outcomes then for the residents, patients, service users that are actually using that system.
Does it make you feel proud when people give you the good feedback and you
100%. I mean, what can be more satisfying than that? If you've worked on something and you get good feedback, there's no better feeling. There really isn't. And as I said, doing that for one company, and obviously doing it with Radar and doing it with sort of like other products and stuff like that, the opportunity to sort of like come to Radar gave me the opportunity to do that on a wider scale. I've seen firsthand the impact that it can have. I've been out into care homes, I've rolled software out sort of like over the years, and when you can go out there and they're saying, oh, you're the one that did Radar, or you're the one that project managed it, or whatever, and you just get that direct feedback. It's satisfying, massively satisfying. So yeah, it's one of the main reasons I suppose that I moved over here. I can broaden my horizons and maybe look at the whole spectrum of health and social care, and just have a bigger impact hopefully across the industry, with a product that I like, that I know that can make a difference. Yeah.
When moving here, obviously after seeing and having the impact that you have made, has anything made you think differently, or do you still feel the same way?
No, I wouldn't say differently. Obviously, I'm still very early in my journey, but from what I've seen so far, every day is sort of like varied. I'm speaking to different customers. I'm finding things out about the system that I didn't know before, which is great. So I'm constantly learning as well, because there's areas of the system that I didn't have the opportunity to use with 4 Seasons, because, as I say, every customer is different and they might not use all modules within the system. So just the fact that I can learn sort of like different areas of the system is great for me, because I'm learning as well. And then hopefully my knowledge then I can obviously pass on to sort of like onboarding new customers.
Yeah. It's a really nice, obviously a really passionate sector to work in, and when you do speak to people, everyone has so much passion. At the end of the day, it's not an easy place to work at all, so you don't go into this kind of role thinking, oh, I'm going to do it because it's easy. You want to help people. Why do you think that it's such an amazing sector to work in?
Yeah, I've had conversations about this topic with so many different people, probably more so over the last couple of years because of the impact of COVID across the industry and stuff like that. And actually, last year, you'll know, I was a guest of Radar as an employee of Four Seasons at the Care Show.
Yeah.
And I actually did a talk for you then as well.
You did.
But yeah, whilst I was there was a talk which had a number of sort of like senior figures from various different, it was all care home operators. And they were basically talking about, you know, the strains and the issues that are kind of like going on in health and social care at the moment. And one particular senior figure, he said something that like completely resonated with me, which was the people that are working like every day in these care homes, going in every day, delivering care, these incredible people, they don't do it as a job. They do it as a vocation. And I just think that is like, you couldn't put it in a better way. There's, you know, through COVID, you know, many industries were sort of like impacted because of COVID. And, you know, some of the things that you touched on was the fact that, you know, Tesco or Amazon, you know, they were offering, you know, £1,000 like joining bonus and things like that for, you know, minimum wage people. But people chose to stay in care.
Yeah.
And they chose to stay there because they're like morally invested in what they do. They want to give care. It's hard to sort of like explain, but they care for the residents that they're looking after. And the lens that like some of these people have gone to, COVID obviously ripped through care homes up and down the country. And, you know, the stories that I was hearing, you know, in Four Seasons, and no doubt it was happening sort of like all over the country, you know, there was units that were it was a COVID unit because all the residents on there had COVID, and there was care workers that were basically prepared to just be based on that unit. They would be completely isolated from like the rest of the home. They would stay there in the spare bedroom so they wouldn't go home. And I just think, you know, that's an incredible thing to do. You're basically sacrificing yourself for, you know, the benefit of others, essentially. And they'll get a huge sense of satisfaction from that. But obviously, that can't be taken for granted. It's kind of going above and beyond sort of like what they're expected to do as a caregiver. But yeah, I think once this sector has you, it has you. It certainly has me. I've been here for 20 years and I can't honestly see myself working in another sector because I just feel so involved with it, and I just know there's so much that can be done, and there's so much opportunity. So yeah, I think, yeah, it is just that you kind of become a part of it, and it becomes a little bit, you just want it every day. You want to keep going back to it, and you want to keep doing it.
Now, there's a BBC like sort of film, I think it's a short film called Help. Have you seen it?
I haven't actually, no.
No, so it's got Jodie Comer in from Killing Eve.
Oh, okay.
And it's all about the pandemic and a care home in Liverpool. And obviously, you don't really understand it when you see it in the news. You empathise and you think, God, that must be awful. But you don't really understand the issues and the stress that people are going through. This film documents that situation so well. And I was in tears watching it because I was like, God, I work in this and I speak to these people and I still didn't understand. And I think she ended up on her own because all of the staff got COVID as well. And she was like running around looking after all these different residents who were really, really quite poorly. And she tried to get through to 111, didn't answer. When they did answer, she was on hold for ages. She tried to ring an ambulance, no one was coming. She had to lift this quite large man and like turn him round to make him feel more comfortable. And she ended up running away with one of the residents to get him out of the care home because she was that stressed. Obviously, I wouldn't recommend that to anyone. But it just, I don't know, it's just so emotional, and I just thought, God, like, I'm so proud to work in what I do because I can actually help these people.
Yeah. I could
really
tell that touched you just from you even talking about it then.
Yeah, just really.
And it does, like, when you, obviously you hear about it, but maybe you don't have an appreciation of it, but when you see it,
definitely,
and when you're in a home and you actually experience it, it's incredible, like what they're doing each and every day.
Yeah.
I think, you know, sometimes my job's like really difficult, like I can't do this, I'm so stressed. And then you go into a care and just think, what am I moaning about, really?
Yeah. Yeah, well, it puts things into perspective, really, doesn't it? But obviously in the care sector, there's a huge recruitment crisis at the moment, and we're talking about how proud people feel, but actually people are nervous because they see how hard it is. What would you say to those people that want to do care but are nervous to take that step into the care, the whole sector?
Just do it.
Yeah. Okay.
It's as simple as that. Obviously, I've not in terms of like delivering care in a care home, that's obviously clearly not what I've done. But if people are, wanting to get into the sector and that particular area is of interest, and they feel they can have an impact, and they want to be involved, then I think the care industry would welcome anybody at this moment in time, because like you say, there is a recruitment crisis, and there's a huge sort of like shortage in all areas, I think, all different sort of like parts to what makes up a care home. So just give it a try, and once you give it a try, you'll never get out of there.
It's a good thing though.
Yeah, definitely.
So going back to your role, why do you think a project manager is important?
So for Radar specifically, I think it makes sure that the customer first and foremost understands the product, and make sure that the customer essentially achieves everything that they want to achieve with the product. So a project manager has obviously got that knowledge and understanding of what the product is capable of. And there's no kind of like, this is how Radar works, and that's the end of it. It's understanding sort of like from the customer side, what are you trying to do? What are your processes? How do you work right now? In an ideal world, if you take the system element out of it, and this is the way I tended to approach it in Four Seasons, I was like, strip away everything else. Don't think about, well, this is Radar, or this is this system, or this is that system, and trying to work in the constraints of what the system can do. If you could do anything, what would you do? How would you do it? And then work back from there. There'll be things that the system can't do, but there might be ways around it. But I think the important thing is, don't try and think about what you're trying to do with the constraints of the system. Think about, in an ideal world, if you could do whatever you wanted with any system, what would you do? And then work back from there. And that's what I did many a time with Four Seasons, and it seemed to work. And I think it's also valuable to understand, what is it that you're actually trying to get out of it? So what is the outcome? What is the data that you're trying to get out? What are you trying to analyse? What are the insights that you're trying to gain? And also work back from there. So sometimes people start at the beginning and they just think about the processes and the questions that they're going to ask. And then they get to the end and they've captured all of this data, and then you ask them, right, so what we're going to do with this data? Oh, well, I won't use that. I don't need that. I don't need that. And it's like, well, why have we asked it? So it's about sometimes thinking upside down, really, and thinking from the end and then working back from there. I think that's pretty much it.
Yeah, Mark Harrison's one of our customer success managers. I'm sure you've met him. He did a podcast a few weeks ago, and he talked about how when people ask for things, he always has to apologise, because he just goes, why? But what's the outcome? And it's about, forget everything else. Like, don't just buy a piece of software because you have to buy a piece of software. Think about the outcome and then go, right, okay, how are we going to do it? And the fact that you've said the same thing, it's just...
Yeah, I think that definitely is it, because there's so many wins to that if you do it that way. You get the data that you want and you're not collecting anything that you don't need. Because of that, you improve the end user experience, because they're not filling out forms all day for no reason whatsoever.
Yeah.
They could be filling out forms, capturing data that nobody's ever going to use. So what's the point? It's a waste of their time. If you can condense that and, I don't know, go from asking them 50 questions to asking them 25, but those 25 are the key things that you need to know about that service on that particular topic. And then the time that they save, if they have the frequency that they have to do that, whether they have to do it weekly or monthly or quarterly, whatever, if you add all of the things up of all the things that you would do, the time that you would save, that time could be spent delivering care to residents, and that's the most important thing. So they shouldn't be sat there behind a computer or behind an iPad basically filling in forms all day. The idea is that that's, I suppose, evidences and allows them to capture the data, that the care that they're delivering, and then from that they can analyse that and identify risks and opportunities to improve the service that they're giving. So it's not supposed to hamper them, it's supposed to improve things and make things better. Yeah.
Makes sense. So what are you most excited about in the future at Radar Healthcare?
Most excited about, it's probably a little bit of a repeat of what I've said earlier, but it is working with all of the different customers. So just having the opportunity to help lots more people than I have been before. Obviously, helping Four Seasons and doing everything that we've done there, just doing that on a wider scale and across a broader spectrum of health and social care. So not just care homes. Obviously, there's dentistries, there's ambulance services, there's NHS trusts, there's all sorts of different areas. There's, and I'm just really looking forward to getting my teeth stuck in, really, and helping as many people as possible.
Yeah. So you can't use the same answer. To summarise, what is your favourite part about working for Radar Healthcare so far?
Favourite part, and I can't use the previous answer. I'll say the culture. Okay. Because I think the culture here is really good. I think you can have the culture is really important because you can have an amazing product. You can have an amazing product that does amazing things, that does everything that you want it to do. But if you've not got the team behind it to kind of like back that up and shore it up, then your product isn't as good as what it was. So I think the culture in this business is great. Everybody's so supportive. I've been welcomed by all areas of the business, whether it's marketing, yourself, people in development. I think we just do things in the right way. We make sure that the talent sort of like within the business like works for each other and looks after each other, and everybody helps each other, which is definitely the way that it should be. So having been on the other side of the fence and now being on this side, it's nice that the experience that I had probably from speaking to a small subset of people within Radar has now been, I can just see it sort of like throughout the business all over. So that's definitely my favourite part.
That's really nice to hear. So now's the tricky question. So this is our What the Health Tech moment. So for our listeners, what this means is a weird and wonderful situation that's kind of happened to you in the health and social care world. If you can't think of anything weird and wonderful, just something that's impacted your life, something that stood out, but ideally just something funny and weird and wonderful.
So I have to be honest here. So I've had the opportunity to do a little bit of research because I've obviously watched all of the other podcasts, and I know that you ask that question to every guest that you have on. So I've had the opportunity to think long and hard about what I could talk about. And there's always one memory that sort of like sticks out from my time with Four Seasons, which I think is, for me, it was like, wow, what a moment. So at the time, this was probably like 4, maybe 5 years ago. So I was working for Brighter Kind, which is essentially one of the 3 brands within Four Seasons. So there's 3 brands in there, all kind of like specialised in different areas of health and social care. But at the time, I was working for Brighter Kind. And at the core of like everything that Brighter Kind did was its core values and its culture. And that was just, it was embedded everywhere in terms of what they do. And one of the sayings that was in Brighter Kind was love every day. And that saying will be forever sort of like etched in my head because I heard it pretty much every other day, whether it was, care staff sort of like saying it to residents saying it back to care staff. So it's just nice that it's kind of like that whole positive sort of like mentality and things. So one of the other sort of like areas of Brighter Kind was they had like signature elements, so parts of the business that kind of, I suppose, were their unique selling point and the nice parts of the business. And one of them was called creating magic moments. So, and that can kind of come in, any shape or size or whatever. But this particular story was about a lady called Muriel, who was a resident at a care home in Chester called, I think it was Crabwell Hall. So Muriel's magic moment was a wish that she had, believe it or not, to ride in a hot air balloon.
Okay.
Now,
really random.
Yeah. Now, this lady was soon to be turning 100.
Oh, really?
And the kind of like wish stemmed back from a conversation that she'd had with an older brother years ago who flew in a hot air balloon, and it kind of must have just stuck in her memory sort of like over the years. And she basically had a wish that that's what she wanted to do. I mean, I don't think I'd go in a hot air balloon now, at 25 years old. I can't imagine going up there, when you're 100. But anyway, that's what she wanted. That was her wish. And the care home made that happen. So one particular morning, the home manager at the time accompanied Muriel to like the location. She had no idea where she was going. It was very early morning, so the idea is that she was going to go on this flight for like an early morning flight, where she would basically be up in the sky to see the sunrise, and that's what happened. Now there's an article online somewhere, and there's a picture that was taken where this is kind of like pre-flight, and like her face is just like unbelievable. Like you've never seen somebody so happy. And it's obviously, you know, when you were talking about, obviously thinking about how passionate people are about working in the sector, it's kind of like those moments, I suppose. So yeah, after that, you know, the home took it sort of like one step further. When she came back to the care home, there was a party for her, where like family and stuff like that were there. Obviously all the other residents, all the staff and stuff, and they let off 100 balloons for her. So yeah, just like, you know, just a really sort of like touching moment. So yeah, that kind of like always sticks in the back of my head as sort of like a wonderful moment that happened. And there'll be many more of them up and down the country, not just obviously in Four Seasons and Bratterkind, but no doubt all over the country. But that's a particular one that sticks out for me.
It's just, I've got a tear in my eye. It's so cute to hear stories like that, and it annoys me when you see the news and you see all these negative stories, and these kind of stories just get lost, and you just like look at the amazing things that they've just done. And you're just reporting stupid stuff that you didn't need to report. That's just my rant for the day. It frustrates me, but that's lovely. That's really lovely. I'm going to look for that article, and I'll share it as well. It's
Good.
Really nice. Yeah, but thank you so much for coming. It's been really nice to talk to you today. I hope you've enjoyed it.
I have, actually.
Good, I'm glad. So next week we're going to hear from Mark Fewster, Chief Product Officer at Radar Healthcare. So Mark is going to talk about our innovation roadmap and what's to come for the products. Don't forget to rate and subscribe wherever you get your podcasts. And if you have any questions for us, our guests, for Craig, then please email whatthehealthtech@radarhealthcare.com. Thank you. Thanks, Craig.
Thank you.